primary survey. Primary survey is the first thing you're going to do when arriving on a scene. The process we go through is as follows. We're going to check for danger. This is danger to ourselves, to others, and to the individual themselves. What's happened? Why is the person there? What could happen to me? We're going to check the individual's response. So are they fully responsive? Are they speaking to us? Or are they unresponsive? Once we've ascertained their response levels, we may want to shout for help. If unresponsive, the next thing we want to do is open and check inside the airway to make sure there's no obstructions. If the airway is clean and clear, we will then check for breathing. This is done by looking, listening, and feeling to what's going on. Place our ears down next to the mouth, look down the chest. We will feel breath on our ear. We will hear them breathing, and we'll be able to see the chest rise and fall all at the same time. So there's 3 ways of checking what's going on. This should be done for 10 seconds. In that 10-second period, we will typically have 2 normal breaths. If they are not breathing, we go into CPR. Use the speaker function on your phone. We can multitask, and the operator won't mind you stopping and starting speaking to them if you have to give breaths. The sooner we can start things, the sooner the casualty can receive better help. Early recognition and call for help will lead to early CPR. They can have a defibrillator sooner on site, and post-resuscitation care will be more readily available to them. Remember, with CPR, danger, response, shout, airway, breathing, 999, CPR. During this video, watch the process. Does the first aider check for dangers? Do they check for responses? Do they shout for help, open and look inside the airway, check for breathing through the look, listen, feel, and then 999 with the speakerphone function for starting CPR. We're going to watch that video one more time. This time I will speak through what's actually happening. Arriving on the scene, checking for dangers, looking after ourselves, putting on gloves, speaking to the casualty, checking for responses, shouting for help, looking inside the airway, then look, listen, feel what's happening for that 10-second period. Phone out of the pocket, open, 999, speakerphone function, and starting CPR. We start with compressions. Left side of the chest, 30 compressions to 2 breaths. With compressions, we want to be around 1/3 depth. With our breaths, we want to give 2 breaths where the chest just rises and falls. If you breathe too much, there's a chance the air could go into the stomach and cause the individual to have a reflex action, resulting in you having an unconscious choking casualty. In this video, you notice I used a face mask. This again looks after me regarding cross-contamination. It's important to have a good seal for this all to work. The airway needs to be open for breaths to go in. Remember the information earlier where we want to get an AED to us as soon as possible. This chart shows how the mortality rate changes as time goes by without an AED on site. With CPR, there are a few instances when we will stop. We will stop giving CPR when the person recovers. We will stop giving CPR when someone else takes over the scene. We will stop giving CPR when we are too tired to continue. If we don't phone for help, we only have two options as to when we will stop. We need to phone for help to make sure that individual is looked after as best as possible and they get the best help as soon as possible. There are a couple of changes to CPR depending on a couple of different scenarios. For an infant or for a child, we want to start with 5 rescue breaths in that CPR scenario. When doing CPR on a child, we want to be starting with those 5 initial rescue breaths. This is because children typically go unresponsive, non-breathing because of a respiratory issue. It's normally something to do with their lungs rather than their heart. Therefore, we start off with the breaths. They also don't have the same ability to retain oxygen, the same way that adults do. Therefore, those 5 breaths are more important. Make sure you have a good seal. Allow time for the chest to rise and fall. Make sure the airway is open. After the 5 breaths, it's normal CPR. With all CPR, we're aiming to compress around 1/3 of the depth of the individual. For an infant, this is approximately 4 centimeters using 2 fingers or 2 thumbs. For a child, we will typically do things with 1 hand and it will be compressed to around 5 centimeters.